So I think I can give you a tiny bit of an introduction. Thank you for joining today. We're really glad that you all took the time to be here and to be with us and talk with us about this very important topic of how you can use digital tools to support people who use drugs, and also what are the best practices in this field. So this webinar is, as you can see from our backgrounds, it's co-organized through the CORE and the BOOST projects. These are both projects that are funded through EU4Health, and the project CORE specifically aims to reduce inequalities in HIV, TB, and viral hepatitis responses. And the project BOOST specifically is aimed at supporting community-based and community-led organizations that work in the field of communicable diseases across Europe. So my name is Ari. I'm from Correlation European Harm Reduction Network. And as Correlation, we work in both projects. So it's also why today we're organizing this webinar. So through the Project Core, one of the things that we did was creating a knowledge hub together with the other partners of the Project Core. And that's a mutual learning platform where you can find a lot of resources, for example, webinars and other materials that can support you in your work as people that work in harm reduction or the field of communicable diseases. And on the other hand, through the project Boost, one of the things that we did was creating these best practices for digital harm reduction services. So we decided a bit to join these two projects today and to use this episode of the Knowledge Hub to present you these best practices. So as maybe you can see, we are recording this webinar. The only part that will be recorded and shared is the initial part of the presentation. So after this introduction, Jemma, that is the lead researcher in the Best Practices project, will give you an introduction, so that will be recorded so that people can also listen to it later. But then we will have a part that is much more interactive, where we will discuss together different topics connected to this. So then that part we're not gonna record, so that also you feel a bit more free in sharing and talking. And yeah, for the first part, it's not really needed that you have your camera on because it will be a presentation. But then for the second part, it would be super nice actually if we can really make this a discussion and see each other, if that's of course possible for you today. Otherwise, it's also okay. So yeah, please let us know in the chat or raise your hand if you have any questions. But yeah, I think I will leave the floor to Jemma to introduce the best practices.
Beautiful. I'll just get everything set up and share my screen as well.
Jemma, we can see the slide. It's going well.
Yeah, beautiful. Sorry, I'm just trying to set up my notes and everything as well. All right, so we have the best practices and recommendations for digital harm reduction services. Thank you again for everyone for joining this webinar. As Ari introduced, my name is Jemma Oldfield. I've been working on this project for a couple months with Correlation under BOOST. And we finally have a publication that's complete now. So I'm really excited to share with you all. This was the contents of my presentation today. We will go through the aim of the publication, who was it for, how it was developed, looking specifically at the methodology. I also wanted to introduce shortly what digital harm reduction services are, and what are some of the advantages and challenges that we face when we develop them. Then we can dive into a bit more of the meaty content of the best practices themselves. and talk a bit more in depthly about the whole process of the digital harm reduction services. So like I said, everything that I'll be talking about today will actually be referenced from the publication, best practices and recommendations for digital harm reduction services, guidance for community-based and community-led organizations. I think Hannah shared a link in the chat where you can find the link for the publication, but I can also share my screen a little bit later and show the publication itself. So this project started out under BOOST, aiming to support community-based and community-led organizations in providing support for communicable disease services. This specific publication itself came from a noticeable gap in comprehensive guidelines to support the design, delivery, and evaluation of digital harm reduction services. We wanted to achieve a consensus on best practices for digital harm reduction services in a way that can be used to evaluate specific tools for digital services and ways that we can effectively deliver services to people who use drugs. The aim of this publication broadly is to discuss this in terms of community, accessibility, and security, but also to contribute to the wider discussion and information about digital harm reduction services, specifically providing the recognition that the topic in the field deserves. This publication is aimed at new organizations who aim to set up a project with digital tools or integrating digital tools into original services. It's aimed at harm reduction projects and services that already utilize digital tools and services that run predominantly offline or in physical practices, and they would like to implement digital technologies into their services. We had a 3-stage mixed methodology design to come up with the best practices and recommendations. This started off with a comprehensive literature review of existing grey and academic literature about digital harm reduction services, about quality standards, about e-health and telehealth, and as much as possible basically related to all these topics. This was reviewed and it was refined into 2 rounds of a Delphi survey, which maybe some of you had participated in, both a qualitative study which looked at the relevance of certain topics and a quantitative study which looked at the importance of certain themes. This was then consolidated into a digital expert meeting where we were able to review and confirm the findings from the Delphi studies. The biggest takeaways from each of these points of the literature review are highlighted here. From the literature review, one of the biggest points is that telehealth, digital health, remote services, they all come with a lot of new challenges. And it's also possible for these services to potentially exacerbate existing inequalities that might be caused by structural barriers or stigma that already exists within the field if these services aren't designed correctly. A lot of the literature also pointed out that there is a lack of an evaluative framework within digital harm reduction services. And this is something that is quite necessary to ensure that we provide adequate level of care. From the Delphi surveys from both rounds, overall, there was just a large consensus on both the relevance and the importance of the items that were taken away from the literature review. The digital expert meeting probably was the biggest shift in the whole project itself. We started off in the conceptualization phase looking at quality standards for digital harm reduction services, but what was pointed out in the digital expert meeting is that this might be too rigid of a concept for now. Quality standards became a bit too much of a structured topic or a structured term to describe something that we wanted to describe a publication that we wanted to have quite a big flexibility and adaptability for community-based and community-led organizations to take up. So this switch from quality standards to the term best practices is to hopefully encourage community organizations to set up their own services without this need and expectation to meet a certain gold standard of service delivery. And it was also discussed that the field is maybe not ready for this government or institutional supported quality standards yet as well. I've done quite a few of these presentations throughout the whole length of the project at different stages, and almost in every one I've included this slide. How do we define digital harm reduction services? And I think it's a really important question to kind of bring up because it's such a broad and diverse range of services. This list up here is from the Eurasian Coalition of Health, Rights, Gender and Sexual Diversity, and it covers a whole range of services, everything from outreach to diagnostics and delivery of goods. It's their own mapping of online care, which already shows how expansive digital harm reduction services can be. Some more little unique ones which come from solely online digital-based services could include trip sitting services, crisis response, community forums, or online service referrals. Things that are just a really broad topic and it's really hard to define into a strict definition. These can include both services that operate completely online, but also services that have a kind of hybrid blend between offline and digital. I mentioned before briefly that we have the possibility that digitalization can help to alleviate a lot of the challenges facing traditional service delivery. The key points of this include the restrictive regulations and legal frameworks that might be faced by harm reduction services, stigma and discrimination and marginalization of service participants, as well as geographical and time barriers that may exist for traditional services. In response, digital harm reduction services are able to provide opportunities and the space for transformation to alleviate some of these barriers. They can also adapt existing services to tackle existing challenges through digitalization and introduce new services and new platforms targeting new and existing communities. Digital harm reduction services are also able to keep up with trends. They are able to keep up with the way that people use drugs. Changes in the way that people use drugs, as we've seen over the last few years, have changed our approach to harm reduction. It's also important to leverage these new communities that form online and target harm reduction efficiently. We're able to think creatively about service delivery. And it's important to note here as well that digital harm reduction does not have the capacity to completely replace traditional online service delivery, but it is really important in overcoming some of these barriers. It becomes a first step in providing for people who may feel stigmatized in accessing offline services, and also a first step and a lower threshold for people accessing services as well. Digital harm reduction services obviously don't come without those challenges. I've talked positively of it so far, but I won't go into too much detail about this list now. But these challenges are mainly what the best practices and recommendations are trying to address. One of the things that the publication really is trying to focus on is this first point of the digital divide. Working with communities, especially who experience marginalization, this can be a really difficult topic. So in the publication itself, we go quite deeply into what this might mean and how digital divide might affect digital harm reduction services. Before going into the points itself, I wanted to point out a couple of examples, some maybe more unique digital harm reduction services that you might not classically think of, to demonstrate some of the ways that you can have creative service output digitally. The first one is from ONG Stop. It's a Spanish organization, and they have a project called Cyber Educators. Here they have an online presence across messenger services such as WhatsApp, Telegram, also on dating apps such as Grindr and MachoBB. And here volunteers will reach out to people and provide either emotional support or also offer to answer any questions related to sexual health or any other questions that they might have at all. I think this is a really good example of building where the people are. So going to where communities exist already online and providing harm reduction there, rather than expecting them to come to you. And the second example I have here is the Nachschatten Reloaded podcast. This is by Sona and Safer Nightlife Berlin. They offer safer use tips and general commentary of trends in party culture in Berlin. This really demonstrates well of thinking creatively about delivering educational material. Podcasts maybe do not always work for every target group, but given the target audience of the Nakshat and Reloaded, I think it's a really creative way to deliver their information. Then we go on to the best practices themselves. This is a list of 8 best practices that we set out in the publication. I'll go through each of them and talk a little bit more in-depthly about it. Unfortunately, we won't have all the time to discuss all the points about it, but hopefully this will at least give you a little bit of introduction to it itself. The first point here we have is the aim and ethical framework. So the digital harm reduction service must have a clearly defined aim and ethical framework that considers the target community and any specified service platform. With this point, we wanted to prompt to think deeply about what the purpose of the service itself is and what contributions does it make being online and operating digitally deliver. Does the digital component act as an introduction to the service? Is it a means of communication? Is it a form of passive service provision? We can also start to think about why a person is accessing a particular service, what context they might be in, what state of awareness they might have. All these little important things that build up to what the service actually will provide. Defining an ethical framework also becomes important when it comes to making operational and organizational decisions about the service. When you're faced with tougher decisions, your ethical framework can give you something to lean on, a bit of a backbone. And we want to think about the project's aim in terms of its longevity and its long-term output. So I realized I hadn't switched a slide there. We want to think about its long-term output. The target community and platform becomes important with defining these things, as they each have a different set of needs. Our second point here is about evidence-informed practices. The digital harm reduction service design, implementation, evaluation must be evidence-informed. The key point here is the distinction of evidence-informed from evidence-based. So evidence-informed focuses specifically on integrating research and clinical experience with client feedback, contextual factors, and lived experiences. This is really important with digital services, given the relatively new field that it operates under, and it's relatively underexplored and under-researched properties. This allows for greater flexibility and also the space to encourage community organizations that might not be able to run multiple trials and collect evidence before piloting a service. Under this also includes the use of existing open source, automated, and AI technologies. One of the things that came up a lot during the digital expert meeting is kind of this understanding of not trying to reinvent the wheel. So already making the most of what is available to you. This also includes the digital community spaces that exist online. So a lot of the time, some projects might have output expectations that you produce an app, which sounds great in theory, but in reality, there might not be much digital foot traffic through this, because it first requires getting community members onto an app and then getting them to engage with the service. So it doesn't reflect deeply what the community actually needs. Our third point is meaningful involvement of community members, so that the digital harm reduction service must meaningfully involve community members in the design, delivery, and evaluation of the service. On some of the feedback that we got with the first draft of the publication, it was that this was one of the most important topics to kind of hit. And involvement of community members is usually inherent in community-based and community-led organizations. A lot of it due to the porous nature of roles with community and peer-based work. But sometimes it can also be quite beneficial to have a more structured approach to community engagement. This could include co-creation of online tools or focus groups, consultations, other ways of integrating community-led feedback. This is a really important step in empowering the community and creating a sense of ownership over the services, which can help promote trust and also increase the way that people interact with the service itself. I had a little example here, but I'm not sure if I'll have too much time to go over it. This is from Simon Community, Get Digital Scotland, The text that's on the screen is actually just an excerpt from the publication itself, but it talks really well about how their community engagement changed their focus of their project and how it actually led to a better and more defined project itself. Our fourth topic is accessibility. So looking at the user experience, user interface, and language. Here we have the digital harm reduction service must make accessibility considerations within their user experience, user interface, and the use of language. When it comes to digital services, we can think about the way that these three things can be used and developed to promote accessibility. So there are a few considerations that can be made. We have on the screen here the altered states of awareness. So when and what context are your service participants accessing your project or service? What technological and digital skills do your service participants have? What technology, devices, internet do your service participants have? And what language does your target speak? So all these considerations can ultimately lead to impacting your design of your service itself. You have some visual considerations, so looking at the types of graphics, the color palette, having clear buttons or simple fonts, some visual feedbacks into interactions of your service, and also some more technical considerations which may address digital literacy and digital access. So how your service might be configured for operating systems, or having downloadable materials available for your service participants. Any type of accessibility plugin also can be included under these steps. Our fifth topic here is data protection, data security. So that the digital harm reduction service must protect the data of service participants and take active measures to ensure data security. The first line here is actually a direct quote from the digital expert meeting. So the best way to provide anonymity and prevent data leaks is to collect no data at all. In some cases, it's not necessary to collect information, but other times it can be important, especially with services that may have more of an e-health or consultation focus. A really good example that came from the meeting was this option to provide a fake email address. So giving the service participant the ability to select a fake email address themselves to let them know that it's not necessarily a barrier for them to access the service. I think this is a really big point when it comes to data protection, data security, and giving over information, especially with a lot of the stigma that surrounds accessing harm reduction services. We want to do as much to not discourage people from accessing the services as possible. Also, as a service, you have the responsibility of protecting your clients. And in a lot of cases, when a service is already up and running and people already have trust in the service itself, they might not think twice about the data infrastructure of it all. Therefore, it's up to the organization to make both technical and organizational decisions based on their established ethical framework, like we've talked about before, concerning the data protection, data security, and also providing clarity to service participants about what data is being collected, what they're consenting to, and making sure that consent is informed as well. Our sixth topic is staff culture, training, and operating procedures. So here we have two statements. The organization of the digital harm reduction service must promote an inclusive and considerate staff culture, as well as service providers and staff must be adequately trained, supported, and understand their roles and responsibilities. So this is the only topic where we have two best practice statements. This is more just to emphasize the importance of staff culture and this whole topic of training and operating procedures in terms of developing the service itself. So something I'm sure we've all experienced when working online or working remotely, working hybridly, is that it's a lot harder to separate your work life from your personal life. And so with digital services, this is something that can become quite a big issue. Addressing this may just start as setting up simple organizational boundaries and encouraging boundaries among service staff, but also providing opportunities to check in with service members and having reflection sessions among staff, or like certain protocols that you might have going about operating procedures. Boundaries can also be encouraged well between service staff and service clients. Another great example would be setting a boundary of voice messages in online peer support and counseling services. So this got brought up in the meeting, is that one of the participants said that they wouldn't let their clients send them voice messages, or wouldn't say that they would listen to them, because a lot of the times it could be muffled or difficult to hear, or take a lot more energy to listen to and respond to, and therefore it's not very reliable in conveying a lot of information. So this was a personal boundary that was set up. In this case, education is also extremely important, especially in services that will be offline or maybe are transitioning more digitally, or integrating digital tools into an offline service where staff might need to be trained a bit more, that they will need to be trained on these, on the way that these tools work and how to use them. It's also important to be mindful that these learning modules can be fatiguing and exhausting as well. So a way around that is to find a way that you can integrate that into workflows and making sure you're not putting too much pressure onto the staff with this. Our final point here is looking at legal frameworks and regulations. So the Digital Harm Reduction Service must be informed about the legal and regulatory frameworks they operate in and take appropriate precautions. The biggest part here is understanding and acknowledging the legal grey zone that a lot of digital harm reduction services operate in. This can be due to national and regional criminalisation of drug use, or the given unregulated nature of the digital space. It's important to consider potential risks and consequences, and also that your staff are aware of this and that your organisation has the necessary precautions against this. I think that's it. I hope that was a decent enough summary of quite a long document. If you have any other questions or anything as well, thank you so much. I'm going to give the floor back, or I'll at least end the presentation.
Thanks so much, Jemma, for your presentation. We've been sharing links in the chat to all of the resources that we've been talking about. So you can also go and explore the best practices for yourself. And we created this web page with different toggles and drop downs so that you can just like dive into the topics that you're more interested in. And there you can see all of the topics that Jemma presented also more in detail. So I think this is a great resource, and yeah, I think it can be really, really supportive for a lot of organizations that maybe want to keep working in the field of digital harm reduction, or maybe want to start expanding a tiny bit in that direction. So yeah, we hope you can make use of that and share also with your networks. For now, we have published this as a web page, but also we will produce a PDF version. So I'll also make sure to follow up by email with all of you so that you also have access to both of those. And yeah, we'd like actually to have a second part of the webinar that is a tiny bit more of a moment of discussion. So yeah, if you would like to maybe turn on your cameras, and maybe we can do a tiny bit of introduction, and then we have a little bit of a structured discussion later. But also, if you have in the first place any questions or like curiosity that comes to mind that you would like to ask now, also don't hesitate to do so.